Dr. Gibson here with Dr. Naidu and Dr. Brilakis. We're talking about cardiogenic shock, and you guys are putting on a course with SCAI in October in Boston. Tell us a little bit about why you're doing the course and what's going to happen there.
Right. So, you want to start?
Absolutely. So it's the shock, as you know, it's been discussed a lot, but still 50% of the people who have shock die in the end, and there's been no change in the last few years. We do have more devices now, more techniques. People are using more of the right heart cath, the swan guns, and the idea was to bring everything together, the heart failure specialist, bring some surgeons, bring the interventional cardiologist, and have a course where someone can come for a day and get a full update about what's the latest and greatest and how you should approach those patients.
Yeah, the other good thing about it is I think we've done a good job of trying to make sure that we can tackle our target audience. So we have breakout sessions for nurses and PAs, people who are really hands-on to make sure that these devices can be put in emergently and troubleshoot. And then we have a higher level discussion for physicians and clinicians about how to manage these patients in the unit. And then there's a whole lot of debate, of course, about when to use these devices, how to evaluate shock, when is the definition of shock kick in, so that we can maybe inform further discussions in the future about how to improve mortality.
So obviously interventional guys and women are putting these in, but you also have nurses coming. Mm-hmm. You also have heart failure doctors coming. Fellows, are they going to be invited?
Absolutely. They're presenting some cases. And
so it's a lot of people. How are you getting the word out to all these different people? You have a lot of people at SCAI, but how are you getting heart failure doctors?
Right. So SCAI has done a good job of partnering with the different societies. We're also in the process of doing a SCAI definition of shock document we'll be talking about later. And I think the idea is to get some of the key players in the different societies involved and have the marketing teams coordinate so that everybody knows about the course. So we also have surgeons who are coming, so they will give the talks on surgical VADs, critical care physicians.
Mm-hmm. Where are we now in terms of management of shock? You know, we have a lot of choices. You know, we have the Impella, tandem heart. Are we moving the needle from 50% survival to something closer to 70%?
Mm-hmm. We had this morning. We had the chip session, and we had actually a couple talks on shock and use of devices. And unfortunately, we have not. Although I think we're understanding a little better of what is going on. We had an audience poll, like how many people have Impella, or everyone raised their hand. How many have balloon pump? Everyone raised their hand. ECMO, the majority raised their hand. Which a few years ago, I think, ECMO was not quite there. And tandem heart, quite a few people actually did raise their hands as well. So I think in the US, we're kind of privileged because we do have access now to multiple different devices. And I think a few years ago, the term ECMO, it was like a foreign language for most interventionalists. Right now, it's becoming more and more. There is the eCPR initiative. Dr. Boudulas had a talk on eCPR. So there's a lot of push on understanding better those devices and using them appropriately so that the mortality can potentially be decreased.
Great. Well, big educational challenge. I want to thank the two of you from SCAI and everyone else for taking it on and organizing this. I look forward to the course in October, right in my hometown of Boston. Thanks, guys. Thanks for coming today. And thanks to all of you for joining us here live from SCAI 2018.